Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today's Friday, June 5th. Appreciate you coming together with us today to talk to a few minutes about COVID-19 and where we are from a community perspective. As you can tell by my look this morning, the heat is turned up outside today and this week. And over the last 13 or 14 weeks without a haircut, I'm starting to get a little shaggy. So it's about time. I'm hoping we get through this so we can all get some haircuts and get back to normal in our lives. I want to start today and talk numbers. Over the last 2 days, I'm so excited and pleased from the city of Mount Pleasant, county judge, our fire chief, Larry McCray, for the work that was done with the state of Texas to get mobile testing this week. We've been asking for it for the last several weeks, and we were able to do it over the last 3 days. On Wednesday, they tested 231 people. On Thursday, they tested 141, and they're still testing today. So you may want to drive by the Civic Center in the next few minutes to see if they have any spots. Symptoms aren't required. County, it does not matter. But it's a good opportunity for a free test if you would like to get tested for COVID-19. But today is the last day. But again, please thank your local officials for the work that was done to have that come to this area. From a total perspective, from Titus Regional Medical Center, our facilities, and the mobile testings before what started yesterday, we have 531 positives that have come through our health system right so far. Over the last week, our numbers dropped from a testing perspective and a positives perspective about 40% last week over the previous 2 weeks. So last week we did see a drop in testing, a drop in positives, and also a drop in the number of patients on our COVID unit, the third floor. We were down to 3 to 4 most of all week last week. Today, we've picked up a little bit on our COVID floor with 8 patients in the hospital today and 1 in ICU. So we've seen a little bit of an increase in some of the acuity of some of our COVID patients as we continue to monitor them, help them through this virus. But the decrease this week in testing is going to be about the same from last week to this week. So look forward to reporting those numbers next week to you and continuing, we hope, to flatten the curve and lower the counts of COVID-19 in this area. I get asked quite a bit and want to bring up, and I appreciate Coach Graham sending me a text last week asking about recoveries. We don't talk a lot about recoveries, and if you look at the state of Texas website, they have numbers up there. Recoveries is a tough one because quite a few of the patients are asymptomatic. Some of the patients, from a recovery standpoint, you don't know exactly when they're recovered. We do have a process at Titus where we're calling our positives on a daily basis to make sure they're well. And that call center's done a phenomenal job over the last month of working with those patients. But one way that I track recoveries and look at recoveries is how many positives you've had in the last 14 days. If we work under the assumption that the majority of the people who've tested positive 14 days, they're going through this virus, we only have 130 to 135 patients who fall in that 14-day window right now, significantly less than what we had last week and 2 weeks ago when we were monitoring 350 patients. So from a recovery standpoint, that number is the recovery is increasing and the number of active cases is decreasing. With that said, please don't forget what I started talking about a minute ago. Our inpatient unit has 8 patients on the floor. This virus will make you sick. And for certain people with certain comorbidities and certain characteristics, the way this virus attacks your body is severe. We have intubated some patients this week. We have flown patients to Tyler. At one point this week, UT Tyler had 7 patients on their COVID floor. All 7 were from Titus. So it just tells you the severity and acuity that you're dealing with. And even though as we start talking about the future, I encourage each one of you and ourselves to not lose fact that this is a very dangerous virus and we need to stay diligent in everything we do. We started yesterday the discussions about opening Titus. Our team met last night and we met with our physicians on Wednesday on joint conference to start talking about different things in Titus Regional Medical Center that we can start opening up. Our visitation policy, some of the clinics, going back to elective surgeries. Those are the things we're working for now. I would encourage you to watch our website and watch our Facebook over the next week as we start implementing those change. Some will come quick, some will come over a couple period weeks, and then some may not happen until July or August or September. But look to the website, look to our Facebook as we start making those announcements, as we start working with our medical staff on how do we open up Titus in the safest way for our patients, our healthcare workers, and this community. But we're excited with the decrease in cases and testing last week and this week that we can start having these discussions again and open up Titus. I'd like to give a shout out to my friends at Northeast Texas. Dr. Clinton and his staff out there, we had the opportunity as an administration team to meet with them this morning and talk to the Safe Return Task Force. The work that our administration is doing at NTCC is phenomenal. As they start classes next week and people start going back to campus this week and they prepare for the fall, they've been working diligently as an administration out there of setting the right protocols and guidelines in place to keep their campus safe. This morning they presented several ideas to us. We collaborated together on some ideas, but it was a great experience. And from a member of this community, a person who lives near the college and has my children have attended the college, I'm very proud of what the college is doing to protect the community, their students, and their faculty. So Dr. Clinton, thank you for the work that you and your team are doing and continue to do for Northeast Texas. You know, with all this going on and things that are happening, we talked about opening Titus and we've closed some things and consolidated some things. One of the things that we're excited to be announcing today is the opening of the Family Care Center Harts Bluff. We've had the Family Care Center on the south side of town next to Herschel's, and we've had the Family Care Center in Dangerfield. Both those physician practices have been phenomenal over the last couple of years in what they're doing for the community. On June 15th, Monday week, we will be opening the Family Care Center on Harts Bluff, the old Dr. Reichert building. I had to throw that in. We're excited about opening up that clinic and what it will do. We're also excited to announce two physicians that will be joining us in opening up the Family Care Center Harts Bluff. On June 15th, Dr. Brad Burrows will be joining Titus Regional Medical Center in opening the Family Care Center Harts Bluff. Allison Rios and Talisha Coleman will be joining him out there on June 15th. It's a big win for our community to have these three providers working in that building and more access. They'll have a lab, they'll have an x-ray, they'll have the ability of a covered driveway for their patients can come up and drop off right beside the door if it's raining. So we're excited for all three of those providers and to offer those services in the Harts Bluff area. The next one we're excited for is on September 1st. Dr. John Cannon, a family practice doctor, will be joining Titus Regional Medical Center. Primary care is critical to our community, and the opportunity that we have to bring Dr. Cannon and his wife to Titus Regional Medical Center and Mount Pleasant is great for all of us. So we're excited. I had the opportunity to work with Dr. Cannon over the last couple months, get to know him and his wife, and they're going to be a great addition to our community. So we're excited about what we're doing at the Family Care Center, Harts Bluff. Guys, again, with the decrease and the opening and the exciting new grand openings that we're announcing, I still will encourage our community to be diligent in everything we're doing. Wear your mask, sanitize, social distance. Everything you do, think through it. And let's be smart as we continue to flatten the curve in Mount Pleasant, Titus County, and Northeast Texas. Again, thank you for the opportunity to join you. Look forward to talking to you next week. God bless.